Welcome to Plastic Surgery T&A. That's Talk and Advice. I am your host, Earl Stephenson Jr. I am your Atlanta board certified plastic surgeon, and I like to welcome you to the channel. For all those returning listeners and viewers, thank you so much. Please share this platform, share this information. There's someone out there who needs to hear it. For anybody who's new, welcome. I really appreciate it. I want you to do a couple of things for me. I want you to subscribe to this channel and share it. It really helps me grow, helps me do amazing things and plan for amazing things in the future. So it's Saturday. I hope you guys are kicking back, enjoying the start of a relaxing weekend. This is really for the ladies. It can be for the guys, but this is really for the ladies. I know countless times I've talked to clients who are concerned about their body contour, their thighs, their butt, their hips, their waist. And we talk about all things. We talk about contours and removing fat and removing excess skin and enhancing, so on and so forth. But the one thing that we've really never had any remedy for is cellulite. And it plagues women like you wouldn't believe. They just can't get through it. And I understand. And we've really never had a good answer until potentially now. A couple of days ago, I met with a rep who represents a device that we're going to talk about, and we're going to really talk heavily about as we move forward in the podcast. And I think it's something that could be really beneficial to help treat cellulite. So if you're interested, and this is perked up in your ears, and this is something you need to know, so take time, sit down, grab a drink, grab breakfast, put the kids with your plus one, or let them go do their thing with their friends and family, and you tune in because this may be information you need to hear. So what I want to do is back up, and I want to talk a little bit about what is cellulite. A lot of times we think cellulite is just clumps of fat, and it really isn't just clumps of excess fat. It really is a connection, a little bit of an abnormal connection, if I can use that. It's a connection between the underlying tissues and the skin. It's really caused by bands. Sometimes these bands can be up and down, vertical, they can be slightly, diagonal, but they create irregularities of the skin. So you're looking at this picture right here, which is just a diagram I pulled off the internet. To your left, you see cellulite, skin with cellulite. You see these bands that look like arches that are pulling on the underlying collagen, causing dimpling. And these bands are the culprits causing dimpling, irregularities, and this is the area that we target for treatment. As you can see to your right, we don't see these U-shaped structures, these tight bands that create this dimpling, so you have smoother skin. So we're trying to create what's on the right, but obviously we're presented with what's on the left, and there have been all kinds of devices used to no avail, really, to help treat cellulite. And I just want to kind of roll through 3 or 4 of them to kind of give you a little historical perspective of where we were, and then we'll get to where we are today. So with that being said, let's talk about the first kind of treatment modality, and that's called Selfina. I don't know if you guys have heard about that. Selfina used really tiny needles to kind of break up those little bands and kind of help release that tight constriction and help smooth the surface of the skin. Really fell out of favor and really was kind of pushed to the side with the advent or the moving forth with another modality that was a little bit technically cooler, if I can say that, and that's called cellulase. Now that used lasers to break up these septa or bands, and the septa is the $1 million word or the medical word for these bands that create cellulite. Again, didn't really have long-term effectiveness, little pricey for everybody involved, for the plastic surgeon or dermatologist to purchase the device, for the patient then to carry that cost by purchasing packages. So again, kind of faded into obscurity. The next treatment in the history of cellulite was the use of high frequency sound waves called resonic. I never really heard of this one. I mean, to be honest with you, I looked this up and found that this was a therapy. I don't know how to use it. It is not around today. Again, never heard of it. I've been in this business almost 20 years and heard of every device that you can imagine. And so probably this never really had any great traction and really great market share. So again, here and gone. So again, very, very few treatment options to this point. So people start to rethink this, and we really start to use radio frequency to tighten skin, loose skin. So someone said, well, maybe we can use radio frequency to help break up these bands. And so there was the development of velo shape. And velo shape is certainly something that has been in the market. I think it's still in the market. I think it has some modest results, but again, nothing overwhelming to propel it as the top treatment or the go-to treatment for cellulite. So, with that being said, again, we as plastic surgeons, certainly I as a plastic surgeon, really had no answer for many, many clients who really wanted some treatment for cellulite because it's just troubling for women, especially in the buttocks and their thighs. You can't wear really, if I can say this, cute clothing. You can't wear really a bathing suit with confidence. You can't wear that nice skirt with confidence. You're really, really gun shy. So we wanted to come up with a resolution, and I didn't come up with a resolution, but some smart people on the West Coast came up with a device, and that device is called, and I believe I'm pronouncing this right, Aveli. Uh, their motto is "No more cellulite nonsense," and all those iterations of devices from Selfina to cellulase to Velashape, maybe it was nonsense. They developed a nice, handy device. It's not a big laser. So, from a practical standpoint, as a plastic surgeon, I don't have to spend $225,000 on the device and then change out the equipment for each patient, which drives up the cost for each patient. And so I have to sell it at a really ridiculous price point. So it's really very simplistic, and I don't mean that in a demeaning way. Design with not a big platform that you have to pour into. It's really a handheld device that has a little bit of a almost a hook to it. And what it does, it hooks those bands and it captures those bands and it cuts those bands. So this is a diagram. You've got the band here on your left. And again, band, the $1 million word is septa. As you can see, the septa is up and down and it's attaching to the skin and it's causing that dimpling. This is not fat that's bulging on the other side. This is actually a dimpling of the skin. And that device, the Aveli device, is inserted after local anesthetic, if it's done in the office, and really is the only procedure being done, through a very small incision near these areas of cellulite. And that septa is basically chopped in half. What can I say? I can't make it any less palatable or any sexier than that. It's chopped in half and it releases that skin so that surface gets to be a lot smoother than you started the day with. So again, it's really targeted. You really can target that dimple. You can then activate that device and you can readily see the release of that band and the improvement right then and there at the time of treatment. So I think that's really important concept that you can see the result right then and there. So with that being said, what are the benefits? What are the benefits for this? So this can be done as an outpatient or in-office procedure on particular areas. And what are the areas? The areas are particularly the buttocks and the thighs. Those are the areas usually most affected. So it can be done as an outpatient or in-office procedure. It can be done under local anesthetic. So no big rev up to a general anesthetic, a hospital procedure, which causes more protocols, more time to be placed into, you know, getting ready for this particular procedure. It can be done just here in the office. Uh, it's targeted, like I said. There are other modalities that use lasers, that use needles, that use sound waves, and there was even a more recent um, treatment, and I think it's called Quo. I may be pronouncing that wrong. QWO, where it used bacterial enzymes to dissolve the septa, and that's really fallen out of favor because of all kinds of problems. But that's not very specific. You just kind of inject it in an area. You can't really tell if that really helped until this healed. With Aveli, you can target that specific band and release it, and you can see. So you have very specific treatment targets, and you can see the results. So it's done in the office, it's specific and targeted. And the downtime, I wouldn't say it's minimal, but it's not like a surgical procedure. You may have a recovery that looks something like this. You may have bruising, which I think can be really kind of compensated or overcome to some degree with taking some arnica or bromelain, which are homeopathic medications. Starting for me, I advocate my patients or clients take it starting about 3 days before any type of procedure that we expect, fair amount of bruising and swelling, and then continuing that maybe for 3 to 5 days after, depending on the degree of bruising and swelling afterwards. So certainly you can expect that. You can expect really some discomfort, some pain that may require a few days, 3 to 4 days of, at least over the counter pain medicine, if not a mild narcotic pain medicine. And where you're going to really feel the sting, so to speak, is when you sit down and when you lie down. So for the first 3 to 5 days, it may be uncomfortable. It may require you to take over the counter medication. It may require you to take a mild narcotic, but certainly doesn't preclude you from moving about, doing your daily activities. You may have to plan a little bit differently or take a little bit more time. Certainly, you might not want to return to work the day that you have the procedure. So it may be beneficial if you have the procedure, say, like on a Thursday or even a Friday, and you can maybe return to work on a Monday or a Tuesday. With probably little to no consequence. So again, modest downtime, uh, targeted treatment can be performed with local anesthetic in the office. So what are some I would not say cons, but what are some of the shortcomings potentially? Every procedure has shortcomings. It's not one procedure is not a an end all and be all for a particular problem. Aveli is great for, I would say, youngish patients, anywhere from 20 to 50. And why do I say that? It's good because it's better for clients or patients who have these bands, these septa, but don't have a lot or have very minimal loose skin. So let's take a look at what would be a reasonable candidate. And that's the key. You gotta pick a reasonable candidate as the plastic surgeon or heck, the dermatologist. So here is what I would consider a reasonable case that you can have a reasonable outcome. You see this patient has dimpling of the outer aspect of her thigh in a couple of places, kind of in the middle of the thigh, up and down, a little bit toward the back of the thigh, and a bit toward the buttocks leg crease. But overall, her skin looks fairly tight, meaning I don't see any looseness or droopiness. So this particular client or patient probably definitely get a reasonable result with Aveli. By targeting those bands, those dimples, you can really release that and really get improvement of the smoothness of the surface. It won't be perfect. No procedure, surgical, non-surgical, is perfect. We're striving for, improvement, significant improvement. So this would be a reasonable candidate for Aveli. Here's somebody who I would think would be a difficult candidate. Again, you have the dimpling that's targeted, but you probably have some more looseness of her skin, especially at the back of the thigh. And so this doesn't mean you can't have Aveli. You can certainly target Aveli for these really deep bands and release those. But you may tell the patient if they want improve smoothness of the surface of their skin beyond what Aveli can do, then they may need additional procedures. They may need some type of contouring procedure, surgical contouring procedure of their thigh. They may need some fat grafting of various areas of the thigh to kind of help smooth this. So Aveli in a vacuum may not help this patient. And overall, if you decide to move forward with this patient, and this patient decides to move forward with you, you have to set that expectation. If you really want to have this patient or client, then yes, it can have some modest improvement at best. You're probably going to need something else. In contrast to the first patient I showed you, hey, patient or client, yes, let's move forward. Aveli, yes, you're going to probably get some, significant improvement. It won't be perfect, but it'll be much improved. Yes, there's always a chance that you may need require some additional procedures, like maybe some fat grafting or some other procedure, but most likely Aveli would probably take care of this, and you would be more than satisfied with your results. So the moral of the story is you've got to set the expectation for the patient. So with that being said, how do you do it? I've kind of alluded to how you do this. I alluded to kind of where this is done, who's a good candidate. So let's go through a couple of scenarios. And let's just leave this picture up as our patient. So this patient comes in and they're just strictly concerned about these areas of cellulite on the outer thigh, on both thighs. Otherwise healthy, no medical problems. Then, as a treating plastic surgeon, this is what I would offer. I say, hey, we have this incredible new device. And just as a disclaimer, this is new. I just got introduced to Aveli myself last week. Now, the device has been FDA approved. It's probably been around since 2021, but I just got introduced to it to myself, and so I'm new to it. So I don't have any real life experience using this device. But we would say, hey, we can use a device called Aveli. It has at least an 80% improvement rate. You're not concerned about anything else. This is an isolated treatment of your outer thighs, both of them. So we have the option of performing this in our office surgery suite. What I would do is I would make sure the patient is a candidate outside of the treatment area, make sure that she's healthy, as we said before. I would probably do this under oral sedation with a little laughing gas as added on. We would numb up that area that needed to be treated on the outer thighs with numbing medication that we typically use to numb during liposuction. It's, in my opinion, the better choice than just using numbing medication that you would use as if you went to the dentist, because I can use more of it and I can use more of it safely. I would I would use that numbing in conjunction with the oral sedation and the laughing gas. And I would make a small incision, probably at the top of the thigh, maybe toward the back of that shadow, and try to treat at least the upper half of those cellulite areas. And then I would probably come from the bottom toward the front. So you have an incision on the back side, an incision on the front side. So it's a little staggered. So it looks a little bit more natural or random as opposed to two incisions on one side. And I would treat the bottom half of that cellulite area. And I would do that for each side. And then I would close that up with a stitch, one or two at the most. I would recommend some type of light support compression, whether that's Spanx, whether that's some yoga pants, whether that's a medical garment. That's really up to the plastic surgeon's discretion and an expert recommendation. But definitely some type of support. It may be for 1 to 2 weeks. The client can go home and rest that evening. Prescriptions for pain medicine. I always prescribe antibiotic to minimize infection chances. So, antibiotics. The next day they can move about normally as their pain will allow them to move, and then we just progress from there. Again, back to work in about a day or two, obviously with some soreness, some discomfort, but hopefully managed by over the counter medication while at work at least. And then we look for, resolution or resolving of bruising and swelling that may occur. Again, I mentioned I would use arnica and bromelain beforehand and afterwards to minimize that. And then moving forward, definitely within a month to two, this area should be completely healed with significant improvement that feels soft and normal. Obviously, the results will be immediate, but the area may feel firm, tight, tender for some time. That's one way to handle it. The second way to handle it is this is a Aveli is an additional or an adjunct or refining procedure. Let's say this young lady had some saddlebags that were above her areas of cellulite. She wanted a little bit of liposuction of her tummy. Then I would say, hey, you're a healthy person, no medical problems. Let's schedule you for the surgery center. We'll do this under general anesthetic. It can be done quickly, efficiently because we have multiple things that we're doing. I will liposuction her abdomen, liposuction her saddlebags on her thighs. I would use that numbing medication just like I stated I would use it in the office to numb up those cellulite or not cellulitic, but cellulite areas, and use Aveli to release those bands. And so she's had liposuction of her tummy, her saddleback, and she's had release of her cellulite area. So in that sense, it is a additional procedure for overall contouring treatment plan or result. So those two ways that it can be done. Again, I think based on what I've read thus far, based on the results that I've seen from Aveli, the results do look really good and promising. So let's look at just a couple of cases of the results that were from Aveli. Again, these are not my personal results at all. And so they were nice enough to mark the areas before and then 3 months after. So at the top, we see, this is going to be a buttocks and a thigh procedure. Again, you don't see a lot of excess hanging loose skin, in my opinion. So we'll look at the top, which is one case, and we'll look at the bottom, which is another case. You see the, areas of cellulite of the buttocks and of the outer thigh. You see before and you see after on the top. Not bad. It is improved. I would believe that the client in this case would be pretty happy with that. So again, that's a really kind of nice improvement. Again, I would believe that that type of treatment or that could be performed in the office. So again, she doesn't have to go to the operating room. She doesn't have to go to sleep. Just a little quicker process to kind of get to her result. Let's look at the bottom example. Again, a little bit more aggressive cellulite of the buttocks, maybe just a tad bit on the outer thigh to our left. But really, the primary focus is the buttocks. And you can see that again, it's a nice improvement. Again, this may be an office procedure depending on the patient's tolerance for, procedure while, somewhat awake or groggy versus, not knowing anything, or the surgeon's comfort with performing the procedure efficiently, effectively. Certainly can be done in office, but certainly can be opted to be done in the operating room as a standalone procedure or a procedure in addition to other procedures. But nonetheless, based on these results from Aveli, it looks like it's a very reasonable, sound, good result. So I think, women who have been chasing, treatment of cellulite with creams and potions and injections and, you know, heat and ice and vacuum therapy and all these things, I think we may be finally onto something that can treat this directly and improve those areas that are really concerning to women that are not amenable to treatment with liposuction, because this is not a fat accumulation problem. This is a tethering problem from bands that tether and cause wrinkling of the skin. So, again, really, really nice results. I have not had the pleasure of using this device, but I would like to have the pleasure of using this device. And if you stuck around for this podcast and we talked about cellulite and its treatment, then I'm going to offer you something unique. This is kind of like a little flash sale. I want you, if you're interested in having this procedure done, I want you to simply do this. And we're going to offer this at a really significant uh, savings. Typically, these treatments run from anywhere from about $3,800 upwards to $5,500, depending on where you are in the United States, who's doing it, and how much experience they have, etc., etc. If you sign up or inquire today or over the weekend, this is Saturday. If you just email me the following information to this email: your name, first and last, your age, a live, viable contact phone number, cell phone, and a live, viable email address that belongs to you, then my staff will call you and we'll talk to you about the significant discount. I'm going to discount this down below the $3,800 mark. But you got to send in your information so that we can call you and we can have this discussion so that you'll know, one, if you're a candidate, one, if you like the significant savings. It's going to be below $3,800. But you need to inquire. You need to send me that information, your first and last name, your cell phone or contact number, and your email address to this email, concierge@esjaesthetics.com. You've got from Saturday to Sunday at midnight. After that, I'm not taking any more emails about this significant savings for Aveli, because I like to I like to offer this to my clients. We need to make sure that this is something that we like in our practice, that gives us predictable results like our other services that we provide, that make sure that to make our patients ecstatic about coming here and referring their friends and family. So we want to make sure that when we investigate this, that it's something that we want to bring on. And this is something that you've already struggled with. So this is a match made in heaven. You want to get rid of your cellulite. You don't want to really pay $5,000. We want to really offer something to our clients, existing and new, that can help them with this at a significant savings. All you have to do is email, name, first name, last name, your cell phone, and your email address, and my staff will call you Monday. But you got between now, Saturday, and midnight Sunday to do that. After that, no more. We'll take the people who have inquired. We'll make sure they're candidates. We'll get them in for evaluation. We'll set them up, and they're going to be on their way. So if you want to be one of those people, I would advise you to email that information to me over the weekend. I really appreciate you guys joining me for this, again, shortened version. I usually go 45 minutes, sometimes an hour, but this is a shortened version of plastic surgery TNA. And we've been talking about cellulite, which is the nemesis of most women. Really hate cellulite. And we think we have an answer. It was brought to us. We talked to the people in the know who are stand behind this. It looks like a great product. We want to have experience with it. We want to offer this to our clients. So I thought it would be nice to talk about it. So if you're interested, follow those instructions to get that significant savings. Otherwise, I will see you in the office if you want to get a consult. You thought I was going to say something else. If you want to consult for anything else, breast, face, abdomen, what have you, I advise you to call the office. Schedule an appointment with me at 770-466-4700. You can always, if you're still not sure, you can always go to my website at www.esjaesthetics.com. Check me out, see what you think, and then call the office. But we're here to serve. I'm about truth and transformation. If you're a great candidate, if I believe I can deliver exceptional results for you, then I love to work with you. If I don't think I can do that, I'll tell you. You may come in, you may not like me. It's okay. I will give you good information so that you can make the best decision for you. So again, hope you guys enjoyed the podcast. I hope you sign up for that special about Aveli. If that's not what you're here for and you want to talk about something else, I hope you see me. Again, have a great weekend. We'll see you next week on Plastic Surgery TNA. That's Plastic Surgery Talk and Advice. I'm your host, Earl Stephenson Jr. I hope that you guys have a wonderful weekend wherever you are in the world. Peace.